This is my nutritional counseling presentation for Mr. Neighbors. So in regard to the dietary food record, you measured the amount of food that was consumed, which gave a more accurate representation of the nutrients and calories that you're consuming. And by recording the time of day, you are able to track your eating habits. And tracking your snacks allowed me to understand the frequency of cariogenic foods in between meals. And the results were inserted into a chronometer app to generate nutrient intake and analyze your overall eating habits. The Steps to a Healthier You form was significant in discovering the role that sugar and carbohydrates played in your risk of developing caries. It also gave an idea of how many servings of each food group you should consume based on your age, gender, activity level, and it compares the results to the My Pyramid recommendations. I chose to use the day that you consume the most cariogenic foods to get a comprehensive analysis of your overall diet. You are fairly sedentary for the majority of the year, and you are an older adult. So therefore you would need 6 servings of grains, 3 servings of vegetables, 4 servings of fruit, 5 servings of meat and beans, and 3 servings of milk to meet your daily recommendations. So you had 6 servings of grains, which is the amount that you would need. You had 6 servings of meat and beans, which exceeds the amount that is suggested for you. You consumed no servings of vegetables that day, so obviously the goal wasn't met. And you had 2 servings of fruit, which is half the recommendation for you. So I would suggest that you focus on consuming more fruits, vegetables, and dairy on a daily basis. You had a fairly high risk for caries based on the sugar and carbohydrates in your diet. So under the category of liquids, you consumed 2 fruit juices throughout the day, which gave you a caries risk of 2. And then under the category of solid and sticky foods, you consumed 1 cookie, crackers, and potato chips throughout the day, which gave you a risk of 6. So when you combine those, that would be a total score of 8, which is at the higher end of the scale for a risk for caries. So for the acid production sheet, it aided in the identification of the source of the forms of sugar that are causing acid production and the amount of time that the oral cavity is in an acidic environment. It also gives a statistical representation of the length of time that the cariogenic foods are affecting the pH of the oral cavity. So basically, microorganisms of the cariogenic foods are protected and nourished in dental biofilm and on the tooth surfaces, and this leads to acid formation. So the organisms from the foods use fermentable carbohydrates to produce acids, and biofilm in excess cariogenic foods can result in dental caries. So the higher frequency of cariogenic foods decreases the ability of calcium and phosphate to remineralize the tooth surface between periods of eating. So the critical pH level for enamel is 4.5 to 5.5, and for cementum it's 6 to 6.7. And this is the level that allows for demineralization of the tooth surface. So to maintain a pH level above these values, the frequency of the carbohydrates that you consume should be decreased throughout the day, and it's suggested that you eat them during mealtime, and that's actually most important, is when you eat the cariogenic foods and not how much of the cariogenic foods you do consume, actually. So you should also have protein and fat at the end of a meal, such as cheese. So you have 2 juice boxes per day, which is a total of 10 liquid sugars over the course of 5 days. The total time that your teeth were exposed to the acids based on liquid sugar is 200 minutes, and that is 40 minutes per day for liquid forms of sugar. For solid forms of sugar, you had cookies and banana 2 days a week, and you had the cookies every day. So even though bananas aren't what you would think of as a form of sugar, they do contain natural sugar, so it is still a form of sugar in a food. So the total amount of solid forms of sugar over the 5 days was 9. So your oral cavity was exposed to acid from solid forms of sugar for 360 minutes, which is 72 minutes per day. So overall, every day with liquids and solid forms of sugar, your oral cavity was exposed to acids 112 minutes per day. This suggests that consuming carcinogenic foods such as carbohydrates and sugars during mealtime, they should be consumed during mealtime, and you should reduce the amount of sugar that you consume also. So in regard to your dietary analysis, it is important for identifying factors in your diet that require necessary changes to improve your overall health of your oral cavity and your overall health in general. So you had multiple deficiencies. Calcium, you met 68% of the goal, and you had 685 milligrams of calcium. So calcium prevents bone loss and promotes soft tissue attachment due to the fact that it is needed for collagen formation. So I would suggest that dairy products and salmon are implemented into your diet. And this may also be related to your vitamin D deficiency, because vitamin D is important for the absorption of calcium and phosphorus, and it also plays a role in the mineralization of teeth. You only had 20% of vitamin D on average throughout the 5 days. So for this, I would recommend that you implement fortified milk, fish oils, and also get UV sunlight exposure as well. So vitamin E, you met 47% of the goal, and you had 7.2 milligrams on average. And this is important. It's an antioxidant that helps maintain tissue integrity. So some things to implement would be whole grains, legumes, seeds, nuts, and greens. So you were also deficient in magnesium. You met 43% of the goal, and you had 184.6 milligrams. It is important for hydroxyapatite crystal formation and bone strength and rigidity. So I would suggest that you implement whole grains, legumes, nuts, and chocolate. So you also were deficient in copper. You met 67% of the goal, and this aids in collagen formation. So this contributes to bone demineralization. And I would suggest whole grains, nuts, dried fruits, and shellfish are implemented. So folate, you met 35% of your overall goal, and it is important for the maturation of red blood cells, DNA synthesis, and homocysteine metabolism. So I would recommend that you increase your intake of animal products, leafy greens, vegetables, and fruit. Zinc, you met 58% of the goal, and it's needed for wound healing and immune integrity, so this is important for your diabetes also. I would suggest that you implement seafood, meats, whole grain, and greens into your diet. So you were also deficient in thiamine or B1. You met 60% of the goal, and it is important for the synthesis of acetylcholine for healthy nerves. So this can cause weight loss, fatigue, edema, and depression. So this deficiency might be contributing to your depression, so I think it's important to make sure you're getting adequate B1 in your diet. So enriched whole grains, cereals, nuts, seeds, and legumes can be added. Omega-3s, you met 64% of the goal, and it's beneficial for your condition of hyperlipidemia. So I would suggest that you incorporate more salmon into your diet for this. You were also deficient in vitamin K. You met 60% of the goal, and it's important for the synthesis of prothrombin in blood clotting and bone proteins. It may cause prolonged clotting time, so I would suggest that Brussels sprouts and asparagus are incorporated and also can help you increase your food group of vegetables every day. So you're also deficient in water intake. Actually, you had only 8 ounces of water per day. At 4 out of the 5 days you had 8 ounces, and one of the days you had 16 ounces. So I would suggest that you do increase your water intake because it can cause dehydration, lead to xerostomia, which you do have evidence of, which is dry mouth, and which can increase your risk for caries. And water also aids in rinsing sugars. And I would suggest that you also increase your water intake because you don't want to have an electrolyte imbalance, which is actually a side effect of your medication furosemide. So I would suggest that you incorporate at least 16 more ounces of water into your daily diet. You are also deficient in fluoride, which aids in the remineralization of your teeth and helps prevent caries. So you are not consuming water from a fluoridated water source. Your Evian water bottles are not a significant amount. They don't have a significant amount of fluoride in them. So I would suggest either switching your water source to a more fluoridated water, or getting fluoride tablets for your home water system. But for systemic fluoride, I would suggest that you incorporate tea, seaweed, and salmon, which is also important for omega-3s. You were deficient in dietary fiber. You met 35% of the goal, and this may suggest that the consistency of your diet is more soft and sticky than firm and fibrous. Your intake of cookies could demonstrate this. So I would advise you to have a more fibrous diet, and this fiber can also help with preventing your stomach ulcers. Carbohydrates, you were deficient in it. You met 69% of the goal, but this is not really an issue for you because it can cause a higher risk of caries as they are used from the diet to produce acids, and acid production can demineralize your teeth. So they should be limited with your diabetes. So when you do have carbohydrates though, I would encourage you to intake more during meals rather than in between meals, so that your oral cavity has time to begin to lower the pH level in between your meals. So you had a few excesses too. You had an excess of vitamin A. You had 208% as an average for over the 5 days, and it is essential for tooth structure, health, and integrity. But I would suggest that you lower egg yolks, green leafy vegetables, orange, red, and yellow vegetables, or fruit in your diet. So you were also had an excess of phosphorus. You had 126% over the 5 days. So I would have you maybe limit the intake of meat, poultry, nuts, legumes, cereals, and processed foods. You also had an excess of saturated fats. You had 22.7 grams, and the recommended allowance is 16 grams. So I would have you limit the amount of cheddar cheese, whole milk, pork, bacon, and eggs in your diet. And omega-3s, if you increase your omega-3s, that can actually help with your hyperlipidemia. but your saturated fats are actually bad for your hyperlipidemia, so I would suggest to decrease these foods and increase your omega-3s. You were also had an excess of sodium. You had 139% for over the 5 days, which is 2,093.8 milligrams. So I would suggest that you do lower your consumption because you do have the conditions of hypertension, hyperlipidemia, you had a recent heart attack, and angina pectoris. So you also had an excess of sugar. You had 58.8 grams on average of sugar over the 5 days. There's no set goal for the sugar, but this would be considered an excess for you since you are at a high risk of caries, and also sugar should be limited because to help control your diabetes. So the main source of sugar that was in your diet was the 1 to 2 cookies you had at night and the 2 juice boxes that you had throughout the day. So, these sugary foods were consumed in between meals. So I would suggest that you reduce your intake by limiting your amount of juice boxes to 1 per day with a meal, and only have 1 cookie a day instead of 2. So for cholesterol, you had 210 milligrams. This is within normal limits for an adult. It doesn't specify your LDL and HDL levels though, so I would suggest that you do get blood testing for that. But you want to keep your cholesterol levels at a minimum because of your hyperlipidemia. So I would suggest that you limit your meat products. In alcohol, you had 15.1 grams of alcohol. Your average daily consumption is equal to slightly more than 1 drink per day, over the 5 days at least. Although this isn't excessive, like the cholesterol, it should be limited because of your hypertension, hyperlipidemia, depression, dental implant, xerostomia, and several medications that indicate that alcohol should be avoided. So the overall goals for your dietary analysis would be to increase your intake of dairy products, salmon, fish oils, plant oils, whole grains, legumes, and nuts. So these are significant sources of vitamin D, calcium, fluoride, copper, and magnesium, which affect the mineralization of bone and the health of your periodontium. So whole grains are also a good source of B1, which, as I mentioned, can help with your depression. And a salmon is a good source of omega-3s, as I mentioned, for your hyperlipidemia, and it's a good source of fluoride. So that would be some systemic fluoride that you could be adding. And legumes and whole grains can also increase your dietary fiber, and that can help with preventing your stomach ulcers. I would also recommend, as I mentioned, to incorporate at least 16 more ounces of water per day. Limit your amounts of red meat, egg yolks, leafy green vegetables, and these are significant sources of vitamin A, phosphorus, and cholesterol, which should be all limited because of your excesses, and your cholesterol levels need to be kept to a minimum. So I would also recommend that you limit your alcohol intake by 1 drink per week so that you're holding yourself accountable to how much you are drinking. And I would also recommend that you limit your sodium intake by 20% by the next appointment. So I would also, like I mentioned, I would like you to limit your sugar by having only 1 juice box instead of 2 with a meal, and then 1 cookie per night instead of 2. So also, remember that it's important to eat carbohydrates during a meal rather than in between the meals to lower your risk of caries, and your unmet categories of fruit, vegetables, and dairy should be increased, and meat products should be limited. But if you are going to have meat, I suggest salmon, which would be a good choice for you. So you consume 2,145 calories on average, and the recommended calorie intake for you based on your age of 59 and your sedentary activity level is 2,200, so you almost met that goal on average over the 5 days, so I think you're doing pretty well with that. So in regard to the dietary analysis and suggested menu planning, this form gives insight to the met and unmet food groups that you are consuming on a daily basis, and I was able to conduct an example menu plan in an accurate manner based on your needs. And with this information, you can alter your diet and make positive changes to your overall health, which in turn can affect the health of your oral cavity and, of course, your overall health. And you are not meeting most of your food group requirements on a daily basis. Your dietary needs are not being met in the groups of dairy, fruit, and vegetables. So for dairy, you on average had 2.4 of your overall servings over the 5 days per day, and the goal is 4 servings, so that was about half. You had about 2.2 servings of vegetables, and the goal is 3.5. And for fruit, you had about only 0.8 of the servings of fruit per day, and your goal is 6 to 11, so definitely lacking on fruit. So you did meet the requirement for meat. However, there is an excess, as I mentioned, so limiting that would be good. You had six servings on average, and the goal is 2 to 3 per day. So you are meeting your dietary needs for grains, which is good. You had an average of 8, and the goal is 6 to 11. So for your goal, I would recommend that you increase your daily consumption of dairy, vegetables, and fruit, and lower your consumption of meat on a daily basis. In regard to your menu plan, I ensured that it met all your requirements and incorporated foods that would help you meet your needs for vitamins, minerals, such as salmon for fluoride and omega-3s, and almonds for copper and dietary fiber. I made sure to add foods that were more fibrous, such as whole grains, fruits, and vegetables. This is also important with your older age, too, to have more fiber in your diet. And I chose snacks that were less cariogenic, and I also kept the cariogenic foods in with meals rather than in between meals. And I also used a lower sodium diet and cholesterol diet to help with your hypertension and hyperlipidemia. And I created a low sugar diet to accommodate your diabetes. So I also planned the times of your meals in coordination with your typical daily schedule based on what times you put down of when you had your meals, but I allowed for your consumption to stop for the acid production to reach normal pH levels before you go to sleep, so rather than going down after you go to sleep. So, and there was no cultural components or beliefs that impacted your diet to take into consideration. So in regard to the EBDM process, this is a way for me to do some research on a product or a recommendation that I think might be best for you and make sure that it does fit your needs and figure out what intervention would be best for your specific needs. So a PICO question encouraged the creation of a relevant question that supports the investigation of valid evidence. So for my PICO question, I asked for patients with increased pocket depths, is controlled release drug therapy with chlorhexidine digluconate compared to minocycline more effective in reducing pocket depths? So my population, my P, was patients with increased pocket depths. The I, the intervention, is the chlorhexidine digluconate. The C, the comparison, is the minocycline. And the O, which is the outcome, is the reduced pocket depths. So for the EBDM process, I used multiple databases, and I found 3 articles. So my first article I found on PubMed, and it compares the use of controlled release drug delivery with chlorhexidine and minocycline on the reduction of pocket depths. So it used 37 participants, 37 participants received the chlorhexidine digluconate as an oral irrigator, and 16 of them received Arestin, which is the same thing as minocycline, as an oral irrigator. So for the conclusion of this study, the chlorhexidine digluconate better improves probing depths of 5 to 6 millimeters, and Arestin improves pocket depths of more than or equal to 7 millimeters. The chlorhexidine digluconate has a 42% improvement after 1 year, and Arestin only has a 30% improvement after 1 year. So they discovered this by measuring pocket depths over the course of 3, 6, and 12 months, and it used participants that fit the criteria of being patients with chronic periodontitis that were treated with supportive non-surgical therapy. So for my second article, I also found it on PubMed. It compares the use of controlled release drug delivery with minocycline and subgingival water irrigation, and it used 15 participants in each group. After 1 administration, it was concluded that there was almost no difference between the effects of low bacterial load after 30 days between the 2 treatments. So they used participants with moderate to severe periodontitis that undergo scaling and root planing. So for the third article, it compares the use of controlled release drug delivery with 0.2% CHX, which is chlorhexidine digluconate, and a placebo as an oral irrigator, with 8 participants in each group. So the results of the study were that 0.2% CHX used 2 times per day was more effective than the placebo irrigator at reducing pocket depths, inflammation, and plaque, reducing plaque. So it used 16 participants that fit the criteria of having adult periodontitis that received scaling and root planing. So these interventions were appropriate for you because you have increased probing depths of 5 and 6, and these products can be professionally placed after periodontal debridement. So the difference between the interventions, there was a difference between the 2. I found that the CHX chip, or the chlorhexidine digluconate, was better in reducing pocket depths long-term and showed better improvement in pocket depths that were 5 to 6 millimeters. And you do have pocket depths that are that depth. So you have pocket depths that exceed 4 millimeters. You have generalized bleeding on probing of more than 10%. You have systemic diseases that likely influence your gingivitis, which is reversible. So this is why I chose the chlorhexidine digluconate for you, and there is no adverse effects with these products. So my recommendation would be to the controlled release drug delivery with chlorhexidine digluconate after scaling and root planing. So this product is also safe for endosteous implants, and it can help maintain their success. So the drug releases over a period of 7 to 10 days and suppresses bacteria up to 11 weeks after placement. So I have printed out an infographic from myplate.com, and it is it explains all of the food groups and different foods that can be incorporated in each food group and the importance of incorporating these food groups into your daily diet. And over here it talks about diabetes actually, and it discusses some dietary tips for you, so some foods that you would want to avoid and some foods that you would want to incorporate into your diet. So I will send this home with you, and I will also give you a copy of my outline from my presentation, so you can bring those both home and have all of that information and use it for the implementations that you can make for your diet.